I cannot say exactly when I first discovered I have sickle cell. All I know, as a child growing up, I've been ill constantly. And my great aunt, she's the one that raised me. I don't know father and mother. And they keep it from me for years. And when I was about 17, she sent my aunt, who's close to me, you hear the name Chichi Spa. So she carried me this day to Dr. Philip. And I said to him, look, I need to know exactly what I have. Because this, every 2 weeks and every 3 weeks, I'm down. And I can't play no sports, and I like sports. So I need to know what I have. And then he tells me that you have sickle cell. I asked him, well, what is that? He said, well, it's a sickness that they said is more white than red. Because in those days, they didn't know exactly, what it really is. And as time progressed, now we learn that it is, the cell is the problem. It's not more red than white. That is for leukemia. It is the situation where your cell, some of your cell is like a stick, straight up, and some round. And the round ones are healthy, but those that are sticks, so that's why we have pain constantly in our joint. So I was about 17, 18 when I discovered. It was painful. There are times when you think about committing suicide because you can't do anything. And everybody's doing everything. And everywhere you go, you just have to sit one place, because if you run, you're sick. If you play cricket, you're sick. If you play football, as soon as you kick the ball, you're sick. So life for me was very miserable. In 2001, between February and March, I spent a whole month because of dehydration. And doctors have said to me, I don't know you're still alive. And I take a lot of drips, more than 28 bags of drips. And I said to myself, boy, what is dehydration, by the way? Eventually I asked the doctor that. So they tell me, well, you didn't drink enough water and so on, so your body dehydrates, it needs a lot of fluid. And I started to drink a lot of water today. So today, water is my medication, because that's helped a whole lot. And I try myself not to get dehydrated. They tell me, well, you can know when you dehydrate if your urine starts to be red. And I scratch my head, because I know before I went into crisis it was red. And I get frightened. I begin to learn, as I mentioned earlier, that there are certain things that you have to do. And one of the things, accept the sickness. And once you start to accept it, learn about it. How can I get around it? How can I exist with people around? Because in those days, the minute as you hear about disease, people back off from you. Especially if you're going around a girl, she only wants to hear you have a disease. Friendship done, no nothing, not even a hi when she see you. For me personally, I can tell when it's happening. My body changes, okay? And then it'll start to feel a signal in which area the problem is coming. Let me use dehydration again. If I don't drink enough water, I begin to have a slight headache. And I learned from a doctor that you can drink water because it is signaling you that you need water. So when you drink the water, a couple of minutes after, it stops. With my hands though, it's different. Begin to feel a little tingle. And then you begin to feel a little pain coming. And I said, okay, don't let this get any further. And so I'll try and find something to eat and then take the tablets, because I learned from drinking so many tablets, when you eat, it functions better. If my knee is going to hurt, sometimes you start to feel a little thing. So if I have something short, I get inside that house and I look for the thickest pants and the longest pants, and I chew on that. And then with the heat, I don't even have to drink tablet. With the heat, the pain will just go. But your body is the one that tells you what is happening at a particular time. So I learned all of these things by practicing. And so even though I'm 56, I still observe what affects me. I'm not on any medication. And so what I do, I just drink natural bush all the time. Apart from the medications, like the IFA and so on, they have played a very important role. The medical bill, if you notice, a lot of sickle cell patients always be in a hospital. Now, think of it and think of how much per night. And you're up in the hospital for like two weeks, 3 weeks, a month. In my case, I was there for about a month. So you know the kind of expense that is. And you doesn't have to pay that bill, medical benefit, absorb that. You have to be very, very thankful that this organization existed and it assists us as one of the chronic sicknesses and so on. For me, I love it really. And the other thing about medical benefit that I really enjoy, if a hospital does not do the test and you go to a private lab, you pay for the test, you can bring a receipt to medical benefit and they will reimburse you. My advice to sicklers is this: do not allow your sickness to dictate your future. You have a future, you know you want to become a rocket scientist or whatever it is. Don't think that because you're sick you can't become. Go after it, but do this. Observe what affects you and avoid it. Drink a lot of fluid and eat your vegetables and take your vitamin and minerals. The other thing I would like to tell them, don't count out yourself. Life has a lot to offer. So anything anybody can do, you can do it. Make good use of your life. Go after your dreams. Don't be around, let me repeat this, don't be around negative people. You already have a low self-esteem. Negative people will always drive you mad because I have nothing good to say. They're always sitting negative. Be around people that are positive, people that will motivate you, and most of all, be around people that love you. And that's what you want as a sickler. People that make you feel good about yourself, people that will motivate you, challenge you, and so on. I teach my children that when they go to marry, make sure that the person doesn't have a trace of sickle cell. I learned this from Mrs. Pickett, the late Mrs. Pickett, when I joined the Sickle Cell Association, because I wasn't really checking for no sickle cell status and so on. All I'm checking, just get a nice wife, somebody that loves me and so on. But then she said in a meeting one day that we have to teach our members that when they look in a mate, see to it that the mate, take a sickle test to know whether or not they have a trait and so on, to alleviate, because a lot of people in Antigua do have sickle cell, and a lot of people that carries the trait. If your mate doesn't have a trait, they're not going to be full-blown. They will have a trait. But the thing is, when they meet somebody, if the person doesn't do a sickle cell status and they have a trait, that's where the problem comes in. Guys, a 50-50 chance that your child might be full-blown, I might just have a trait. I might not have any. With parents with sickle children, one of the things that you can do as a parent, because I'm a parent, is love your children. Even though that they have the sickness, make sure that they drink a lot, their fluid, their special water and so on. And eat a lot of fruits. I always have a positive attitude. And I learn as much as I can about the sickle cell. I'm staying alive because of love. My children love me, my wife loves me, my relatives love me. I try to do things that are positive, that will keep my mind away from it. And the other thing I like to do, I like to ask God to help me.